All right. Good evening, ladies and gentlemen. So thank you everyone for attending today's SMID. No more I already, sorry, SMP training. Okay, so today we will be moving a little bit beyond our normal GLP-1 training series, okay? It is still under GLP-1, but of course for the past 2 to 3 months, we have been very focused about what is GLP-1 and its relationship with insulin resistance and how everything tie into our core, which is metabolic health. Okay? Hello? All right. Yeah, which is our core, metabolic health. So today I wanted to expand and to go beyond that and to move into how GLP-1 can affect surrounding organs. So we'll do a bit of that. And of course, today's focus will be more on the heart, right? And next 2 weeks on the 23rd, we will be talking about the liver, right? And how everything tie into a complete picture and how it actually goes beyond just insulin resistance. So just to give you a bit of background about what was my thought process, okay, as I was planning this training series. So I was just thinking what to talk about, okay? So then it leads into the heart, right? So I thought that why I chose the heart, because I felt that when it comes to other organs in the body, right? When it comes, okay, don't talk about other organs now, right? What are people's priorities? If we always talk about, okay, weight loss, right? We talk about like beauty, all right, collagen, or even like pain, right? These are areas that people are more drawn towards paying more attention to, okay? Because these are areas that I think people are just more akin to it lah. It's more attached to their self-esteem maybe, or people cannot stand discomfort, all right? But despite of that, right, I think everyone knows that the heart is very important. Am I right? Okay, so it is actually one of the most important, it is the most important organ. Because if our heart stops beating, we literally will not be live. But if other part of the body, like even if our skin is not that pretty, right, we can still live on it actually. Okay, so even if we are not that pretty, but actually we can still live. But heart is one of those things that people tend to always put it as a back burner one. Okay, it's one of the least important, I would say. People will not want to supplement things for the heart unless they have a problem. Okay, so because of this, I feel personally that heart health is not really paid a lot of attention to. And now with GLP-1, obviously we know that the angle, why people are so drawn towards GLP-1 is really because of weight loss, of external appearance, right? So we have to talk about the heart because I feel that it is very much neglected. And looking at news nowadays, this is not something that we can only categorize to people who appear to be overweight or unhealthy. Again, more and more people who are very healthy, athletic, young, are also victims of heart attack and stroke-related conditions. Okay, so to just have a bit of awareness of that and why talking about the heart is very important. Okay, so when I talk about the heart, right, or heart attack, what are the first two words that appear in your mind? Okay, in every condition, there's definitely a word that appear, right? So for me, as I was doing this topic, when I think about the word heart attack or stroke, okay, this word will appear to me, for me. All right, so it's unpredictable and secondly, it's very sudden. All right, okay, I'm not trying to downplay the effect of cancer. All right, of course, we know cancer is a debilitating condition. Obviously, the illness and everything is a terrible condition. But in terms about time critical factor, right? Heart attack is really one of those things that really just once you get it, you just go, right? It is good for the patient in the sense that the patient don't have to go through a lot of pain, as compared to a cancer patient. Okay, cancer patient, they have to go through a lot of suffering. But for heart attack, it will affect people around them. Okay, we find it very hard to reconcile. Oh, suddenly life just gone. And the person don't even have any preparation towards the future, and that's gone like that, right? So this is one of those things that all the more we should pay a bit more attention about this. Okay, and these are some of the recent figures that we know who are actually quite young who pass on due to a heart condition. All right, so this person, I'm not too sure if you are aware, is actually a Malaysian politician. Hannah Yeoh speaks very highly of him. He's Salahuddin Ayub, right? Okay, quite a well-known politician. And these are all celebrity figures, okay, that you see here that are look, and these are athletes now. They are really young, okay, in their prime, okay. They should be not in this picture, all right. So when you look at all these people, you just feel that there's only one word, you just feel it's very wasted, okay, and how you can't even come in terms that this is way beyond their age, okay, prematurely. So this is the trend that's happening. The people who are 30s, and this is actually, Zhang Zijie, the latest news, as we know that this uh, badminton player passed on in the middle of match. All right. So with all these things considered, all right, why is it so critical? All right. So it says that in 30 minutes, if the person's heart stops, okay, if there's a heart attack, there will be irreversible damage within 30 minutes. Okay, that's how critical the time is. So if you just delay 1 minute, okay, there's additional damage that will happen to other blood vessels in the body. So if it's more than 30 minutes, okay, within that, all right, you are closer and closer to death. So if you think about the ambulance coming, just late a little bit, right? That's why sometimes we all hear stories, right? That we have loved ones or relatives, because it's just too late. 4 hours, traffic jam, then that's it. You lose the person already. Okay, so this is how critical. And heart is something that you really cannot afford for it to stop. So we have to do everything that we can to ensure that our heart remains strong, at all times. So what is the difference between heart attack and stroke? Okay, I want to talk about this a bit because I think there's some confusion surrounding both of these topics. People always assume that they are the same thing. Okay, so first of all, we'll look into the symptoms first. Okay, so at least you know if you are having or you know a loved one who have heart attack or stroke. Okay, because both are actually very different conditions. So heart attack, obviously, it goes very direct to the heart. So symptoms would be shortness of breath, chest pain, dizziness, anxiety, nausea, vomiting. So these are more towards heart attack related conditions. Stroke is on the brain. Okay, stroke basically there is aneurysm, all right, or it could be a rupture of blood clot. So really depending how serious it is. And the kind of symptom is always more towards your motor movement, balance, weakness. So if your arm or speech slurring, and then a person will look a bit disoriented. So those are more signs of stroke. Okay. So both of these, of course, are also very critical conditions. But if you were to ask me, heart attack is more serious. Okay, because stroke is not so critical, in the sense that your brain have many different blood vessels, and depending, of course, how serious it is also. If it's just a blood clot or aneurysm, if it doesn't rupture, it's still fine. There's still a chance of recovery. But heart attack, unless you can save within the time, actually, you go really. All right. So both are critical, but heart attack would be actually more serious in this case. All right. So looking at statistics all around the world, actually they're all pretty consistent, but there are some variations here and there in our Asian region. Okay, so this is for Malaysia. So you see heart disease is the number one cause of death. All right, followed by pneumonia, then infection. And okay, this is surprisingly 2023. It's pretty recent. COVID is actually one of the top death rate. Okay, Singapore, however, is slightly different, but of course, ischemic heart-related diseases is number two, but cancer is the top in Singapore. So I mean, there's some differences, but okay, but it's still one of the top few conditions. All right, so now actually there are new report that talks not just only about the middle-aged people, because that one we know already. Okay, obviously we know that middle-aged people are having definitely a higher risk. Okay, but now there are studies showing that the younger population are actually at risk. Okay, it's a worrying trend. But more younger people are getting heart attacks today compared to 5 years ago. Okay, which is not that long ago, by the way. So growing trend in younger people, especially among parents of young children, maybe because they're very stressed, and of course those who are single, more tend to overwork. So this productive age gap was often busy working with little to no time to consume a healthy diet and exercise. And of course, poor sleep habits also increase heart attack risk. So all these things will accumulate over time. So this is actually a bit disturbing. It says that 9 in 10 Malaysians experience some level of insomnia and have one or more sleep problems. Okay, so I think Singapore also won't differ very far from Malaysian data. Okay, and this shows that most of us, not every one of us, don't have enough sleep. Okay, especially those who watch drama in the late night. Okay, those people really are much higher risk. Okay, all right. So what does GLP-1 got to do in this picture? Okay, how does it tie into our narrative today? Now, okay, so GLP-1 actually is not just this. Okay, so what we have learned in the past 3 months actually talks a lot about pancreas, right? We really try to understand the nature about how GLP-1 interacts with insulin and how it affects metabolic health. But it actually has a cascade of reaction over all these core organs in our body. All right. So let's go through them one by one. So talking about the brain, okay, apparently GLP-1 is neuroprotective. So it does protect the brain and it also reduces inflammation. And currently there is a study ongoing on Alzheimer's. Okay, they are trying to investigate and to see if GLP-1 can help to also help in Alzheimer's as well, all right? Age-related mental illnesses. So they're actually looking into investigating that. So in the heart area, which will be going into detail, would be the heart, okay, that improves heart function and cardio blood muscles, all right? Which we'll be expounding a little bit more today. And interestingly, it has a relationship with our bone health. It says that with GLP-1, it can actually increase bone mineral density and bone formation. And the liver, okay, it also helps to decrease fat storage liver and reduces the release of sugar to the blood. Okay, so that there will not be so much sugar present in the blood. Our liver don't produce excess sugar. And it also affects how our muscle will use sugar more efficiently, breakdown of stored fats, weight loss, and of course, is protective to pancreatic cell and insulin sensitivity. All right, due to time constraint, I can't go through everything in detail. So today will be on this, okay? And for the next 2 weeks, on the 23rd, we will focus on the liver. All right, and actually liver is very, very important. And I think that's not being discussed about more often because it is indeed a very important organ in terms of metabolic health as well. Okay, so I want to talk about blood pressure for a bit. I think if you ask 10 people, right, 10 of them would say that cholesterol is obviously a heart-related condition, right? They would think about atherosclerosis, and for them to treat cholesterol would be, okay, I have to do something about this. But blood pressure, on the other hand, I feel that people don't really know how serious it is actually. Okay, if people have high blood pressure, they can ignore it. Okay, unless it's very high, like 200 or 180, okay, then I'll take some medication. But if the person have a clean blood, blood lipid profile, but they have high blood pressure, usually they don't want to do anything about it because it's like, oh, it's like not a very serious thing, right? And how does it actually relate to heart condition? Right? So I think it's quite important to revisit some of these important key points. All right. So this is the nature of our blood vessel. Right. So this is when it's clear. Okay. When blood is flowing. All right. So this is build up. This is actually not cholesterol clots. Okay. Cholesterol is actually here. But this is muscle, the thickening of your artery. Okay. Because what happens when you have high blood pressure, right? It makes your blood vessel contract very hard. Okay. It has to keep on contracting. So even our artery got some muscle one, Okay, there are muscles and there are some, arterial lining that will tend to thicken over time. So this is what they call the thickening of the artery wall. It is not due to cholesterol, but it will become narrower. You see the diameter here, it gets narrower. So your heart has to work harder, all right? And not just only that, once there is blood pressure increase, right, you will also damage your blood vessel. Okay, you have to keep on constricting, so very likely there'll be a tear or something in your artery. So if there's any LDL or surrounding cholesterol, then your cholesterol will very likely also deposit at that area and it becomes even worse. So this is the nature of a healthy vessel, and you see how it transitions from healthy to a hypertension type of blood vessel is very narrow. Okay, so this is actually very dangerous as well, normal pre-hypertension and hypertension. Okay, even though many times when a person die, okay, stroke or whatever, they very likely always point to, blood, this plaque, but actually a lot of them has to do with blood pressure related reasons as well. Okay, so hyperpressure forces the heart to work harder to pump to the rest of the body. Okay, and this causes the left heart muscle. Okay, not just only the artery, but then you can see how it actually affects the muscle as well. So this is a normal heart, all right, and this is a hypertensive heart, which you see the muscle here is actually thicker already. So it's actually constricting and it will cause it to pump even harder. So this is why a thickened and enlarged ventricle raises the risk of heart attack and heart failure. And this can also affect other organs in the body, such as blindness and kidney failure. Okay, so kidney failure has quite a strong relationship with blood pressure as well. Okay, so usually those who have high blood pressure, doctor would warn them, okay, can actually lead to kidney related issues. Okay, so GLP-1, okay, I'm going to go into the angle of blood pressure since we're talking about this, right? So how does it actually work? So this is our normal blood vessel, and this is how it vasodilates, okay? It's a vasodilator, so it will help to, these are the receptors out there on the blood vessel. Okay, so once you can dilate, then it means your blood vessel become bigger, so the blood flow will be better as well. So it will put less stress on your heart, and also your blood vessel will be so thick. It's able to relax. Okay, so it decrease blood pressure, remove of cellular waste is better as well. So on and so forth with the nutrients and glucose that's needed for your body. Right? So there are GLP-1 receptors in the blood vessel. Okay, GLP-1 binds on blood vessel, make the blood vessel relax. More blood can pass through, less stress on the blood vessel and protects the blood vessel. So this is how it can help to lower blood pressure. All right? And also, GLP-1 targets heart health, right? Because there are also receptors that are found in cardiac tissue. So it's found that activation of all these receptors can lead to improved cardiac function. Okay, improve heart muscles, glucose uptake, and heart pumping ability. Okay, because your heart is able to utilize glucose better. So a more efficient source of energy, it makes your heart able to pump more efficiently. Okay, don't have to keep on, a more regulated pumping activity. So these effects can contribute to better cardiovascular function and potentially lower blood pressure. And these effects can also help to protect the kidney. Right, so currently GLP-1, right, of course, we know there are a lot of studies that is done on insulin resistance, sugar control, and things like that. So now they're also looking into heart health as well. They're starting to observe a positive trend in how it can help to benefit heart health and cardiovascular indicators. So now they're going to go into more in-depth study, and more reports, I'm pretty sure, will come out in the next few months or so that talks about how GLP-1 will move towards cardiovascular health as well. Okay, it's already out there. All right, so how GLP-1 benefits the other indicators? All right, so GLP-1 also help in managing our blood lipid profile, such as insulin sensitivity. Okay, fat, muscle, other cells can use it better. Okay, less excess sugar in the blood to become triglyceride. Okay, so this is how we can reduce TG levels in our blood. Okay, and also it reduces the production of cholesterol, LDL, and triglyceride in the liver. Okay, so actually GLP-1 block, all right, and help to reduce overall your lipid profile. Okay, and also increase the clearance of LDL as well. And it can overall reduce cardiovascular and stroke risk. Okay, so GLP-1 goes more than just weight loss. All right, we see all this. Okay, it's actually just more than that. What's being marketed out there is just a very small piece of the puzzle, right? And its benefits is definitely more than just weight loss alone. So it's key for us to increase GLP-1 really. Okay, it's not just for those who are, and there's nothing wrong, honestly, if you want to look good. Frankly, there's nothing wrong. But then it has other benefits that can protect your organs as well. So of course it's key. So today I'm gonna go through this pretty briefly in terms of feel great. Okay, of course we know this helps to increase GLP-1. But I'll spend a bit more time after this to focus on some other key supplements, all right, that I just want to take the time to emphasize a bit more, so that as we are on this feel great, right, it's more than just feel great, right? There are other supporting nutrients that can really help to benefit the heart, all right, and of course other areas as well. Okay, So let's go into this GLP-1. So I can say confidently, even until today, we are one of the first few, all right, supplement-wise that can prove that our products can increase GLP-1 levels, all right? So right now, supplement is the only source, okay? It has to go through the natural route, right? Uh, that we use food ingredients to trigger the intestine to produce even more GLP-1. So this is direct, I mean, food-wise is the only way, okay, unless you take injection. Okay, so this is the study that's conducted by Dr. Benjamin Whitman. So he found a very impressive result that this is control group and this is those yerba mate. So those who are in the yerba mate have close to double the amount of GLP-1 compared to those who are just drinking water only. Okay, so this is a visual for everyone to see that for those who are just drinking water, these are your normal GLP-1 levels. So if we were to convert it, okay, into, this is just numerically for everyone to have an illustration, yeah, it can go up to double, right? So this is pretty good result. And this is actually not from any form of drug. Okay, this is really just from yerba mate alone. Okay, so if we were to drink water, we can already observe such tremendous benefit. So what more if we increase, right? So more yerba mate gives you more GLP-1 and in turn, it can give you even more benefit, even to your heart health. So there's this study I saw that they conduct drinking yerba mate among postmenopausal women. So those who have menopause, actually, they are much higher risk of heart attack as well, cardiovascular disease. So they take up to 1 liter, those who take up to 1 liter of yerba mate, but the only drawback from this study is that they didn't tell you exactly how much you take. 1 liter, I think, is a lot, but actually our product also, we can be taking 1 liter, really depending how you mix. I will be assuming at least two sachets, you can take 1 liter, right? So if they take 1 liter, they observe, right, their risk of getting cardiovascular related complication and risk is reduced quite significantly, Can say 30 to 50% not mistaken. Okay, they can actually reduce the risk quite significantly. So this study, it's not a very large scale study. Okay, it's about like 100 over participants and it's among postmenopausal women. So it's quite interesting to see how it is, especially those who are leaning towards an age group have this complication and how yerba mate can provide that kind of benefit to them. Right? Even though the sample size is not huge, but I think this finding is actually pretty significant and positive as well, especially for those who are, in this age group. Okay, so of course we covered about how GLP-1 can increase when you're not eating. So when you're eating, this is actually the most difficult part lah. All right, if we humans can live without eating, of course, it's a different story lah. Then we don't have to even talk about this already. But this is actually the main reason why many people break, their fast, and this is why their health deteriorates. It's really because of the food that they're taking. So in our study, it shows that Biostaf S also increases GLP-1 by activating L cells to produce even more GLP-1. Right, so 6 different fiber types, they will go through fermentation in our body once we take it, and it will produce this thing called short-chain fatty acids, all right? So they will signal the L cell to release GLP-1, and the gut will switch on the GLP-1 signal as well in the brain. So this will signal our GLP-1 to, keep on producing. And by the way, not all types of fiber can do this. We need specific type. And we don't only use one type of soluble fiber, we utilize 6 types. Right? So if we have a combination of many fibers, we can increase the microbiome diversity. So this actually encourages even more variety of short-chain fatty acid to be produced, which activates the GLP-1 even better. So an hour or two after eating no fiber meal, GLP-1 actually go down and crash very quickly as well. Its lifespan is very short in the body. So we have to ensure that we take this so that our GLP-1 levels can remain high as long as possible. Right? So Biostaf S also helps in cholesterol levels, stabilizing blood sugars and decreasing fat absorption. So all these things that Biostaf S does can also help to reduce the risk of heart disease. So in combination, Biostaf S and Mini Mate, they help to increase our GLP-1, right? Which you can see these are receptor sites that bind to our blood vessel, to our heart, cardiac muscle as well. And both of these together can also help to benefit the well-being of these organs to function even better. Okay, so these are our studies that shows how balance or S can reduce our blood sugars. Okay, and together they are really honestly the best combination in combating insulin resistance. Okay, right now if you're talking about supplement wise, both of these really is the way to go to help us increase organic GLP-1 levels. So moving into some other supplements that I really want to talk about, okay, one of these things is CoQ10. It's been some time since I talked about this, okay, but since we're on this, okay, let's just revisit some core important things. So CoQ10 is really like that, it's like that fuel, all right, like that kind of energy vitamin that powers the mitochondria, especially in our heart. Okay, it is a source of energy, it provides stability to your heart, and also is an antioxidant. So it's actually very important in the heart one. Okay, it provides stability and make sure that your heart muscles are well regulated. So, okay, there are several organs that require high amount of CoQ10, especially the kidney, the liver. Okay, these two are also organs that have high energy activity, so they require a lot of CoQ10 as well. So it does not only benefit the heart, it also benefit other organs and our genes as well, because our genes will always change, they degenerate, and then they recover again. So there's a very high activity component as well. So all these fast acting, high turnover cells require a lot of energy to do so. So CoQ10 is very good for that. So for those who have PCOS or fertility issues, actually CoQ10 is also quite good in that sense. Yeah. All right. So CoQ10 reduces, okay, in our body, we only have a certain fixed amount of reserve in our body. Okay, it's very little only. So it will decline with age, stress, diseases, statin use. So if you have stress or diseases, statin, your CoQ10 will deplete even faster, and our body don't produce it. It's only up to a certain level. Okay, and it also continue to decline if you have cardiovascular diseases, diabetes, obesity, Parkinson, cancer, and etc. So all these are the different states that could further deplete our CoQ10 levels. Okay, so these are actually very important things to take note, and that's why CoQ10 is important now. Okay, so it's a fun fact. Okay, this how you can get 100 milligram of CoQ10, right? So the numbers are pretty out there. Okay, 50 cups of spinach, 60 avocados. Okay, 133 tablespoons of olive oil. Okay, I really don't think in my lifetime I would take 60 avocados. Okay, that's quite a stretch. So it's quite difficult to get CoQ10 from food, honestly. So even doctors themselves, they're very conservative when it comes to medication. But when it comes to supplement, like CoQ10, they really do encourage patients to take from supplement source, okay, because it's just too difficult to extract the same amounts from food source. Okay, so I actually forgot to put the slide on our own CoQ10. So actually our CoQ10 is pretty good. We use ubiquinol. So ubiquinol is a higher quality and it's also the more important kind of CoQ10 that our body needs in our circulation. So a lot of, in the supplement out there, they use ubiquinol, which is not so good, all right? They need to go through a conversion process to become ubiquinol. So Unicity CoQ10 actually is also on the high quality end side as well. So I highly encourage for those who are, if you always feel like you're very stressed out, okay, you're always exercising or in that category, I highly encourage you to take CoQ10 to further fuel your heart muscles. Okay, so moving on to another major antioxidant, we have vitamin C. So vitamin C, it has more than just immune function. It does help to strengthen our blood vessel as well. Okay, it helps to reduce LDL oxidation effect onto the blood vessel. So it prevents inflammation, which is speed up the breakdown of our blood vessel. So vitamin C helps to intercept with that. Okay, and our body does not produce vitamin C and our body loses this nutrient very quickly. So we have a mixture of 4 different types of vitamin C, and each serving have 600 milligrams of vitamin C. So it's equivalent to 100 oranges. All right, so it helps to really take on the difficult work for you, and you extract that in in the high quality form so that your body is able to utilize the nutrients well. Okay, so apart from vitamin C, there's also omega-3 resolve. Okay, so these are some of the core ones. So omega-3, a subsequent meta-analysis which concluded data from over 10 studies, okay, they show that fish oil omega-3 supplement lower the risk of heart attack and death from coronary heart disease. So this has really been very well established studies out there for a long time really. So this is not just only for heart, but for blood vessel to reduce inflammation. Okay, so omega-3 is one of the top things that you need to have in your line up. So omega-3 have antioxidant and anti-inflammatory effect, counter highly inflammatory omega-6 oil. Okay, so this is very hard to avoid, especially if you eat out. So we need to have something that counter this. If not, there'll be a lot of inflammation in the body. Okay, so it helps to improve the function of the cells lining the blood vessel. It also helps to benefit the blood lipid profile, to lower triglyceride and increase HDL levels. All right. So optimal heart health really is this together, right? So if you're already on feel great, think that's great, all right? This is a bonus. If you're already on feel great, honestly, heart health is a bonus really. Okay, because GLP-1 does help to strengthen your heart muscle, okay, help to reduce blood pressure, help to strengthen the blood vessel lining, okay? So if you're on feel great, you already have some of this covered. Okay, but if you're on a very stressful lifestyle, okay, if you know they don't really have much sleep, and if you're of a certain age, okay, actually not really, I think young people also, if you can actually consider 4 to 10 also, because I honestly don't think that young people are exempted from diseases and all that already. Okay, with the kind of report that's coming out, younger people are now more and more at risk. Okay, we're not talking about those who are very old, like 35, like now it's like 17 years old, 20 over, late 20s, can also have heart-related disease, and that K-pop star was like 30 years old only. So actually it can happen to anyone. So I don't dare to say that, because you're young, you may not really need to take CoQ10. Actually, that's not really true. Okay, because stress is actually a very big factor as well that can really put a lot of strain in your heart. And your heart has to pump over time to compensate with that. And one day it just, okay, you cannot support your body already. Touch wood. So of course, things like omega resolve and biopsy, I think is something that you should already have in your lineup if you don't, because these are actually pretty crucial things that we need to cover just for general well-being, right? Immunity and things like that. Okay, so I highly encourage you to explore. Okay, if you're just on this, is great. But if you can add on some other crucial supplement to really support, because the body is made up from many different organs, right? So we need that to have a more complete, comprehensive covering to our health. Right? So okay, yeah. So that's about it for today's session. Right? I was a bit worried that I'll exceed the time, but looks like I'm able to rush in between that time allocated. So let me introduce a little bit about next week's session. Okay, so we were moving into the liver. So I think liver is one of those organs that we also haven't really expound a lot. I think to most people, they think that the liver is just a detoxifying organ, right? If those who drink much, then okay, their liver may be compromised. But actually, the function of liver is a lot more than that. It is as important as the pancreas when it comes to sugar utilization, glucose, cholesterol, and everything. Actually, the liver has a very big part in it. Yeah, I would say it is as important as the pancreas, honestly. All right, so that's why I put this the metabolic mastermind. Okay, it is a metabolic mastermind. All right, and how feel great, especially feel great, is very beneficial, and we have some really good study results I want to share with you as well that Dr. Benjamin did share about how it can help the liver. Okay, so mark your calendars and make sure that you can come for this segment. All right. Okay, yeah. So we have come to the end of today's session. All right. So if you have any questions, you can feel free to drop a question. All right. Then anything heart related, or you have any questions, please feel free to ask. Right. Okay. Yay. There's some response from the floor. Okay, so unit matter 11 and bar 7 is good for GLP-1. Yes, actually it is. I think I answered this question before, So yeah, bar 7 and S actually is not that different. So I don't see why it cannot. So definitely it can also help in increasing GLP-1. All right, I have a general question. Okay, but the general question is not here yet. All right. Okay, so hi Claudia. If one drink 1 liter of minimalistic, can you drink every time? Actually, you can drink it anytime, really, but it really depends how your body can adapt to it, because there are high caffeine content, you see. So for those who can have a high tolerance to caffeine, some of them they drink even before sleep. Also, they can sleep when. So it really depends. Some people can drink up to 3 packets, no problem. So I really think that it's up to your individual tolerance. Yeah, if you can go up to 2 packets a day, 2 packets, as your body can tolerate, really. So if you can tolerate, then why not? Okay, you can drink 1 liter, 1.5. No problem. Okay, so it's found in every cells. There are specific organ that we see just now, like bone, okay, liver. Not every cell has GLP-1 receptor actually. I guess it's just specific organs that's being highlighted in that chart. Okay, so like our bone, fat, muscle, liver, okay, for now. Kidney not, don't know about that yet. Okay, but those that are being discovered are what we have talked about just now, which is most of the important core organs. All right. Okay, so continue on the general question. Wow, very long question. Okay, so feel great CoQ10 Omega Life 3 BioC with suitable add-on suit for product of users with cardiovascular condition. Yes. Yeah, can. Okay, and of course, depending how severe is the cardiovascular condition. If it's just like high blood pressure, those on statins, actually, I do encourage them to take CoQ10, those on statins especially because their CoQ10 deplete even faster one. So there's actually a good point. You bring up a very good point actually. Another product that could introduce to them. So I would say, yeah, if you can, you can give Resolve and CoQ10. Of course, but if you can take biopsy, even better, right? Okay, but if you're talking about those heart condition that's very serious one, actually it's all right also lah. These are very general supplements, but you would definitely ask for doctor's advice in that. But if not, if it's just general kind of heart, high cholesterol, blood pressure, not a very severe kind of heart uh, arrhythmia, then I think you should be fine. Okay? Okay, so I think the omega-3 is 6, 7, 9. 9 is okay, but 6 is not very good. Omega-7, actually, I haven't really heard of omega-7 now. See, I know there's 3, 6, and 9. So I know 6 is not that good. So 9 is okay. So we need to be a specific ratio for these three different options, but your omega-3 has to be the highest, all right, to offset those other not so good omegas, okay, like the 6. All right. Yep. So now we have few FG plus for heart condition users. You're right. Okay, and not just only that, it really depends. If the person is a very stressful person or not enough sleep, can actually also encourage them to take CoQ10. They may even feel better with that. Okay, it helps with their heart and liver also actually. Okay, so it looks like this is the end of today's session. So thank you for attending. So yeah, please stay tuned to the 23rd. We have some exciting results to share with you. Okay, thank you everyone for your time. We'd love to see you again soon. Okay, good night. Take care. Bye.